The World Health Organization, WHO, is warning us about both bird flu and fungus as potential pandemics. Given the fact that many of us did not pay enough attention to what was happening with COVID-19 and then it hit us like a ton of bricks, we are now closely watching the warnings from WHO to see if we can spot any potential warning signs. Dr. Tedros from WHO recently warned us about bird flu and why it is becoming increasingly serious. In recent weeks, there have been reports of several mammals, including minks, otters, foxes, and sea lions, being infected with H5N1 avian influenza. H5N1 has been spreading widely in wild birds and poultry for 25 years, but the recent spillover to mammals needs to be closely monitored. Although WHO assesses the risk to humans as low, we cannot assume that it will remain the case and must prepare for any potential changes in the situation. People are advised to report dead or sick wild animals to the local authorities instead of touching or collecting them. WHO is working closely with national authorities and partners to monitor the situation and study any cases of H5N1 infection in humans when they occur. WHO's Global Laboratory Network and Global Influenza Surveillance and Response System are tracking strains of circulating influenza viruses and providing advice to countries on the risk to human health and available control measures. WHO recommends that countries strengthen surveillance in settings where humans and farmed or wild animals interact. WHO is also working with manufacturers to ensure that, if needed, vaccines and antivirals will be available for global use. While vaccines and antivirals are being mobilized, it is important to note that some people are skeptical about the motivations behind their creation. For example, one of the largest funders of WHO is the Bill and Melinda Gates Foundation, and some people believe that vaccines are being created so that record profits and billions of dollars can be made from them. The New York Times recently covered the H5N1 bird flu, stating that the world needs to act urgently before it has a chance of becoming a devastating pandemic. According to WHO, the new strain of bird flu has been shown to be fatal in 56% of cases studied between December 23 and January 5 of this year. This fatality rate is higher than COVID-19, but we cannot definitively bank on this 56% number, as the number of cases studied is relatively small. Dr. Tedros mentions that bird flu has been a concern for over 25 years. In 2009, when a bird flu outbreak was covered by the media, Dr. Fauci gave advice to avoid places where people are sick and coughing in order to minimize the risk of infection.
Thank you for watching. Don't forget to like and subscribe for more great content in the future.